background.
Hi, James. I don't see an option for chat, but did you have a preference on starting and
Uh,
how?
it doesn't matter to me. Do you want to do 20s and 20 or 2020?
I prefer 15-15 right now. I'm
Okay,
not
that's
sure
fine.
of the content.
Yeah, that's fine. That's totally fine. 15-15. I can start if you want.
Okay, sounds good.
All right, thanks, Paul.
Paul, when you hit on your screen, when you click on your name, you should see ask to unmute or three dots. If you click on those three dots, do you see the chat option there?
Oh no, I do have the chat option. I just mean like it doesn't offer me the option to pick James' name. It
Oh,
only
him directly.
host and co-host.
Okay. Okay. Okay.
But that's fine. We won't need the chat option really. I just wanted to confirm how we were going to proceed before we started.
I just let Heather in. Heather, do you want to test your audio?
Can you hear me?
Yes. Can you say a little bit?
Go ahead.
I just wanted to hear a little bit more to check the volume.
Am I good?
That sounds pretty good.
Yeah.
Okay.
Right. I just let Ryan in too. Ryan, do you want to check your audio, make sure it's working?
Hello, everyone. This
Sounds
is Ryan
great.
Templeton, the PHA provider convening. Thanks, Melissa.
That's 1 o'clock. Should we
Letting
begin?
people in.
I would say yes. Let's go ahead and invite people in if we haven't done so already. Good afternoon, everybody. We're going to give it another minute or so to let everyone join, and then we'll get started with our provider convening. All right, why don't we go ahead and get started, and we can go right to the next slide. So it's my privilege to welcome you to our June provider convening. My name is Mark Conajani. I'm the interim division director for statewide programs here at the Behavioral Health Administration. So welcome. Here's the agenda. You can kind of see for yourself the different topics that we'll be covering. We'll have an introduction of our provider convening work team. We're going to get a legislative update. And Ryan or Andrea Jones, I'm not sure which or both if you're going to tag team it, but we'll get to that. Mariana Sears will be giving us a ASAM update. Heather Pash will give us a care coordination update. Karen Shapelo will be able to share information about the fentanyl education program. And then I'll be giving an update related to the BOSO RFP. So with that, I will hand it over to Jill. Jill, I think you're muted.
Sorry about that. I'll start again. Today's ASL interpreters are James Gay and Paul Villarreal, and you can spotlight these interpreters so that they will appear larger on your screen. You do that by hovering over the right corner of the ASL videos and select Pin if you would like to see them larger on your screen. We are expecting a larger audience today, so please stay muted unless you are speaking. There will be a limited amount of time at the end of each presentation for questions and answers. And so we do ask that you put your questions in the chat. So we will share your questions. And if a question cannot be answered today, someone will follow up with you via email. This meeting is being recorded, and we will post the slide deck and the video on our website after this event. I think that covers everything. If you do have an opportunity to speak, we kindly ask that you introduce yourself and your agency. Thank you. I'll turn it over to Webster.
Good afternoon, all, and welcome. I want to remind you of the BHA statewide program team is hosting these bi-monthly convening meetings to discuss information and updates relating to provider services and give you the opportunity for ongoing engagement and contributions toward mission. Next slide, please. Next slide, please. And our mission is to co-create a people-first behavioral health system that meets the needs of all people in Colorado. And so we really appreciate you joining us in that mission. And these meetings will be recorded for later review if you choose to do so. Thank you.
Thank you, Webster. I want to remind everyone, I think everyone that's been here before is familiar with BHA's executive leadership team, but our commissioner is Danette Smith. Deputy Commissioner of Engagement is Kelly Causey. Deputy Commissioner of Systems and Programs is Aaron Wester. And Stephen Pang is our interim chief administration and financial officer. I do not believe they're here with us today, but wanted to acknowledge them. And then I want to cover the statewide programs division is really the team that puts this together. We obviously draw on all the expertise from BHA as well as from providers to bring content that's useful to all of you. Again, I'm the interim statewide program division director. We've got some time for Danielle and Paul and Valerie and Carrie if they are here to come off mute and introduce yourself, and then I'll give the same chance for the support team, the provider convening support team.
Hi, good afternoon, everyone. I'm Danielle Culp, and I'm the statewide programs process and justice involvement director. So great to see everyone this afternoon.
Hi, everybody. I'm Paul Burnett, pronouns he, him, the Director of Child, Youth, and Family Services, and glad to be here today.
Good afternoon, everyone. My name is Valerie Resendez, and I am the co-interim adult treatment and recovery director.
Okay, how about, it's possible Carrie isn't able to join us, so I'll, Webster, you've already said hello. How about Melissa and the rest of the team? Say hello and introduce yourselves.
Hello, I'm Melissa Morales. I'm the program assistant for the statewide programs.
Thanks.
Sam?
Hello, I'm Sammy Warner, and I am the program assistant for the TDA team.
And Jill, I know you're here, so you could say hello. And I don't know if Sarah Lucas, she may not have been able to join us today.
Hello, everyone. Thanks for joining us.
Thanks. All right, and with this, I'll pass it over to Ryan Templeton and Andrea Jones, I believe, to give an update on the legislative session that has ended and what has come of that. So take it away.
Thanks, Mark. You just get me, Ryan Templeton, today. Andrea is doing some other stuff. So with that, I'm Ryan Templeton. I'm the Policy and External Affairs Division Director with the Behavioral Health Administration, here to provide that legislative update. A couple fun things. The session ended, the 2024 legislative session ended on May 8th, which was about 6 weeks ago. Some of the big numbers, there's 705 bills that were introduced during the 2024 legislative session, with 525 bills being approved. So after that May 8th date of the session ending, the governor had 30 days to take action on bills, which included signing bills, vetoing bills, or just letting bills pass without a signature. So that has ended. So the bills that did make it through have been signed or vetoed or passed without signature. So we are there. We are at go time essentially when the funding kicks in. But with that, BHA tracked 36 behavioral health related bills. Not all of those bills impacted the Behavioral Health Administration directly, and not all of those bills passed. There are 17 bills that impacted the BHA directly. So we are currently working on our external facing legislative session recaps. So with the update to our website, we'll put that on our website with where you can click on bills to get to the pages that those 17 bills that impact the BHA directly. I'll go over a few of those today. And just know that we are working on our work plans for each of those 17 as well. Some of them are bigger than others. Some of them have a whole lot of moving pieces, and today's update I'll focus more on what is more specific to BHA than the bill as a whole. Just know that some bills have multiple state agencies doing specific things. So be on the lookout for that if you're interested. So with that, want to highlight our two BHA agenda bills. Agenda bills are the bills that we got approval before the session started to really get behind and champion. First one being Senate Bill 1, which was the continue the Youth Mental Health Services Program. This bill makes permanent the Youth Mental Health Services Program, commonly known as iMatter. The bill requires the program vendor to annually deliver BHA information and data about the program. The change from that is we were updating or providing legislative updates or legislative reports twice a year. Now it's once a year, a little bit more consistent, but then there's more data reporting requirements as well. BHA also has to conduct surveys of the providers who participate in the program and collect data from providers and program vendors for that annual evaluation. One key piece to that, like I said, it is now permanent. So the iMatter program repeal date is now set at June 30th of 2034. So at 10 years down the road, and it's at $5 million a year. You may be asking, $5 million? That sounds great. It is a little bit of a decrease than our annual budget previously, which was $6 million. That's part of the funding piece. We were at a pretty tight budget this year, but very, very positive that made the iMatter program permanent there. So thank you for all of the testimony that some of you all provided to get this to pass the finish line. Another agenda item for us was House Bill 1038, which is the High Acuity Crisis for Children and Youth. So this bill expands programs for youth who are in or at risk of being placed in out-of-home care. BHA is tasked with working with healthcare policy and financing, our Medicaid agency, to develop a system of care for children and youth who are less than 21 years of age and who have complex behavioral health needs. A big piece for BHA in this one is that we have to promulgate rules. So a regulatory process will be happening over the summer and into the fall about the administration of the kid system of care really for the Medicaid kids. It also expands funding for BHA to pay for room and board for Medicaid eligible youth receiving residential mental health treatment. So in total, that bill is $38 million a year. So a pretty big investment for high acuity kids. So those were our two agenda bills. Go into some other ones that we were very, very actively engaged in. Senate Bill 55, which is the agricultural and rural behavioral health care. So this assigns BHA a specific staff person to serve as the liaison between BHA, the Department of Agriculture, behavioral health care providers, rural community leaders, agricultural communities, and nonprofit organizations that serve agricultural communities. And then that also requires the BHA to develop and deliver a training to these partners to better adjust the behavioral health needs of individuals in agricultural communities. This was one of those ones where agricultural communities and rural communities have their own behavioral health needs that we definitely need to target. And this was an opportunity for us to work with Rocky Mountain Farmers Union to help drive this piece of legislation to really support those rural and agricultural communities across Colorado. So excited about that one. House Bill 1045, as I mentioned earlier, there's some bills that have a whole lot of moving pieces. House Bill 1045, the treatment of substance use disorders, is one of those. So this one for the BHA, more the BHA specific parts of this 25-page bill, is that it requires the BHA to contract with an independent third party to support providers seeking to become approved BHA safety net providers. So that's providing technical assistance, how to access the enhanced funding of being a comprehensive or an essential provider. So that is the behavioral health safety net providers. So yeah, third-party contractor to help support those providers seeking to become essentials or comprehensives. It also creates a contingency management grant program to support providers in implementing contingency management programs to treat stimulant use disorder. Yeah, very positive program there. That's an evidence-based program. It also requires BHA to review the admission criteria for withdrawal management facilities and collect data on denials of care within withdrawal management settings. So this is a prime example of us trying to establish what those work plans look like, and coming up with what does that look like for our approved providers or withdrawal management facilities, and how that would look collecting that new data. And then the big piece of this 1045 was it authorizes healthcare policy and finance to apply for 1115 waiver from the federal government to provide pre-release coverage to individuals being released from carceral settings or incarceration settings. If the waiver is approved, BHA will work with healthcare policy and finance to ensure rules for MAT are aligned with the requirements of the bill and identify funding streams to make sure that we get that federal match for what that 1115 waiver would provide, but also a massive step to making sure that there is continuity and for individuals, yeah, leaving carceral settings. There's some other pieces that 1045 creates, but those were the BHA specific pieces there. House Bill 1176, Behavioral Health Grant for Capital Project. This bill expands the scope of the Behavioral Health Care Continuum GAP grant program. So that was House Bill 1281. So it expands that to include awarding a $4 million community investment grant for a new capital construction project. So if you're interested in that, be on the lookout for that procurement happening, assuming sometime soon. House Bill 24-1217 is sharing of patient healthcare information. This bill requires BHA to create a friends and family input form to allow a patient's family and friends to supply relevant information to providers. So to get to that family input form, the BHA is required to solicit feedback from stakeholders and legal experts to make the form available by July 1 of 2025. So if you're interested in this, I'm interested in participating in stakeholder events to produce this friends and family input form. Be on the lookout for that. We'll probably start closer to the fall with some of those things because we have other regulatory pieces like 1038, that high acuity piece that we have to get to as well. The last one I'll provide an update on is House Bill 1355, measures to reduce the competency wait list. So this bill creates the Bridges Wraparound Care Program in the Office of Statewide Behavioral Health Court Liaisons. So the Behavioral Health Court Liaisons is commonly referred to Bridges of Colorado. And that program is to refer eligible individuals from the criminal justice system into mental health services. So divert them from the criminal justice system into mental health services. With that, the bill requires each judicial district to enter into a memorandum of understanding with the Bridges Wraparound Care Program, as well as making sure there's referrals with the district attorney, MOUs with public defenders and Department of Human Services, as well as the Behavioral Health Administration and treatment providers, local behavioral health case management programs, and other stakeholders. So this is a pretty complex working across a whole bunch of different state agencies and each judicial district. So with that, there will be some work going into this, really coming out of that Bridges of Colorado office. to develop those MOUs, and it's a rolling timeframe to get all judicial districts up to speed within this program. With that, once again, remind folks that we will be providing a legislative wrap up or a legislative recap on our website. So be on the lookout for that over the next couple of weeks. And as my parting, I just want to thank you all for the effort that you've all been putting into talking about behavioral health and advocating for change. Behavioral health is no longer a taboo subject at the Capitol, and it was just a few years ago. So I think there's a big commitment that has happened from providers, from state agencies, that we have to be able to talk about behavioral health in order to get the change that we need. And that has really risen into some very positive pieces of legislation over the last few years, including in 2024. So with that, thank you. If there's any questions, definitely you can send them my way, to my email, as well as our Legislative Affairs Officer, Erica Gannett, as well as the Deputy Policy Director, Andrea Jones, as we can answer anything offline as well. With that, Mark, I'll kick it back to you if there's.
Sure. Does anyone have questions right now while we have Ryan right in front of us before we go on to the next presentation on ASAM? Going once, going twice. Okay. With that, I will welcome Mary Anna Sears to walk us through updates on ASAM criteria 4th edition.
Awesome. Thank you very much, Mark. Can you hear me okay? Working? Awesome. Okay. Hello, everybody. My name is Mary Anna Sears. My pronouns are she, her, and I am one of the safety net licensing managers with the Behavioral Health Administration. What I will be presenting on briefly today is updates around the 4th edition of ASAM criteria, the stakeholder survey that was completed last month, and how we're going to incorporate that into our stakeholder plan going forward, including an invitation to our first stakeholder event officially for this purpose next month. Next slide, please. All right, so let's start first with the survey and what it says. So we had 27 survey respondents that completed this survey for us last month. So that's a great start for engagement. I highlighted 2 of the major respondent categories here. The majority of the respondents self-identified as providers of large behavioral health organizations. And then we had several respondents from regional accountable entities or RAIs. So both very important partners that we need to have at the table as part of these discussions. But those were the 2 major categories of respondents that we received feedback from. The top 5 preferred types of involvements that we've heard from folks that they want as part of this ASAM 4th edition transition are listening sessions, virtual interactive events, work groups, whether they are singular or on a repeated basis focused on particular topics, virtual report outs, town hall type style report out and updates, as well as newsletter and website updates. So we're going to use that information going forward to make sure that we're incorporating as much of this as possible going forward. This is not the only way that we plan to engage, but we're hoping to incorporate the majority of that feedback into the plan going forward. And we received another great suggestion to gather feedback through multiple mini surveys, 5 questions or less on a topic, right? Little power bursts of information gathering or information sharing in smaller batches, as opposed to really larger surveys. And that's a very intriguing suggestion. So that is something we're going to try incorporating going forward. Next slide, please. So here we have a visual of our lovely state of Colorado divided down by counties. And you can see we have stars that are representing one or more provider or individual that identified with lived experience that responded from this particular area across the state. Those are represented by the white stars. And then when you see the gray stars, those represent the 2 RAIs that we had responding across the state. So as you can see, there's not 27 total stars here. We just did, if one individual responded from that county, 1 star to represent that that area had a respondent. But as you can see, we have a good bit of representation, the Western, Northern, and Denver metro area. We have a little bit of work to do to try to engage the Southern and Eastern portion of the state, and that is something that we'll take seriously and try to pull in going forward as well. But there's your visual. Next slide, please. Okay, so based off of the feedback that we've received, loud and clear, the concern across providers was level 3.2 withdrawal management and what this is going to mean for our state. We were expecting that. That is a concern that has been bubbling for a while. And so we're going to start, after hearing from you all, with a level 3.2 withdrawal management focused workshop, and we're beginning that next month. So as you can see here, this is going to be starting with a virtual listening session, going with virtual so we can get as many voices present in the room as possible to start and to help us devise our plan going forward. There are going to be representatives from the Behavioral Health Administration, as well as healthcare policy and finance representatives. So that way we can all hear at the same time what the concerns are and develop this plan going forward. We hope to invite you to join us as well. As you can see, the virtual platform is to be determined. We're still working out some logistics of whether or not a Zoom or a Google Meet will be our better platform for this as a starting point. But there is a calendar hold that is available on the BHA Laws and Rules website on the calendar. If you want to add that to your calendar as a save the date or a placeholder, please just know that the registration and link information has not been determined yet and will be added soon. And again, really this particular focus as our starting point, this is really based off of that stakeholder feedback. This particular transition needs prompt attention, it needs alignment early and often. So we're planning to use this first true engagement for a stakeholder event to help identify what this means for your communities, and as well as figure out the next steps for this ACM 3.2 specific workshop. We're going to use focus questions to help guide the conversation as well. Next slide, please. So this last slide is really the formal information. How do I keep up on information or become involved with this? So I have a couple links that I'm going to go ahead and try to pop into the chat here. And hopefully this works okay. Nope, it looks like it didn't. I can come back and fix these unless Melissa or somebody might have a moment to check the links at the bottom. Sorry about that. Could be because they're emails and they're not going to link. But for more information, we have two main websites that are going to house information around this ASAM 4th edition change that is listed here. The BHA Laws and Rules page, which is hyperlinked in the chat, as well as HCPF's SUD benefits page. We're going to have a lot of shared information between those two pages. As far as newsletters, which was another request that folks made to receive information about updates, we have two main newsletters that are going to be primarily housing this information. One is the BHA Quality and Standards newsletter. The second one is HCPF's SUD Providers newsletter, which, as you can see here, we've got a little note saying that it's going to be transitioning over to the behavioral health newsletter for HCPF. This is a transition that is slated to occur in the very near future, really broadening that newsletter from just SUD only providers into behavioral health. So a great change in a positive direction for individuals who are already registered as part of the SUD provider newsletter for HCPF. My understanding is your information will transition automatically onto that listserv, so you don't have to do any new registration or anything like that. You will just transition into the updated newsletter listserv. But we will have the hyperlink for you to register for the newsletter otherwise if you'd like. And then finally, there's a couple of the main emails that we will be utilizing for BHA, the BHA feedback email, as well as HCPF, the SUD benefits email. That is it for me today. And I believe I am handing it over to Heather for the next portion of today's event.
Well, do you mind switching it to the next? There we go. So hello, if we haven't met yet, I'm the Director of Care Coordination, and we have some programs that have gone into effect starting January 1, 2024, and we have a couple of others that are starting July 1st, 2024. So we wanted to take some time to give you an update so you're aware of those changes. Jill, do you mind switching the slide, please? All right, so first of all, our care navigation certification training will start in the Own Path system July 1st, 2024, and that's going to be available for anyone that does care coordination, care navigation type roles. So they can now get a certification for that. Our next one is we hold regular office hours and trainings for providers and judicial staff or jail staff. Those typically are related to our emergency department assistance program, the civil certification program that's going into effect at July 1st of this year, and really anything that's care coordination related for the BHA. So feel free to pop on to those. It's the first Monday of the month at 11 and the fourth Monday of the month at 3 p.m. And then all of our trainings can be found on the website, which hopefully normally Melissa Morales magically includes that information in the chat. So hopefully you'll have that there. And then Jill, do you mind swapping to our next slide, please? And then here's how you can contact us if you have questions related to our emergency assistance program that started January 1st, 2024. Our civil certification program that starts July 1st, 2024, and the trainings that we've had ongoing, those kind of go between what we've been doing since January and going forward. And also if you have questions related to that Care Navigator certification program. So feel free to use those. We're happy to assist however we can. And I believe that's my last slide. So if there's no questions, I'm happy to pass it on to the next person.
I apologize. I do have a question real quick. I was looking at your web. This is Mark Steiger. I'm the Director of Behavioral Health at Larimer County Jail in Fort Collins. I have a question about the civil cert with the competency that starts on July 1st. I'm trying to find your training on that just so we have a clear path when that comes through next month. Is there a training specifically on that, on the way the courts will do that for the competency?
So they've been doing trainings this month. I'm coming back from a leave, so I'm still trying to figure out what's going on, I'll be honest. But if you email callie.lickness@state.co, she can definitely set up a training specifically for y'all if you haven't been able to attend some of those trainings that have gone on.
Awesome.
So that would be your best bet.
Thank you.
Sure. Any other questions I can help with? All right, I'm going to pass it on. Thank you for your time.
Hi, I'm Karen Chaplow. I am the Fentanyl Education Program Manager with the BHA, and I'm going to talk a little bit about the Fentanyl Education Program. Next slide. So this came out of the Fentanyl Accountability and Prevention Act, which is a 73-page piece of legislation. And thank you, Melissa. And it's quite extensive. I'm going to talk a little bit about the bill and what's in it, just so people get a sense of what's out there in the world trying to help folks with fentanyl. But there are two studies being completed. One is through CU and one is through CDPHE. And these studies are going to focus on individuals being referred to substance use treatment instead of the judicial system, overdoses and deaths, initiation and retention on medications for OUD, and overall health outcomes. So that's what those studies are focused on. CDPHE is managing harm reduction grants and has an education campaign. And their website is keepthepartysafe.org if you want to look at it and check it out. It's quite interesting and it's very dynamic. You can tell it's geared towards adolescents mostly, I think young people, but it's very neat. Then the adult treatment team with here at the BHA is providing training and education to first responders and working on increasing synthetic opioid treatment services. Then the JBBS has a big chunk of this, and they're working on getting MAT services, or have been getting MAT services into the jails, and then providing linkage to care for when people are discharged from the jails. And then there's my program, the fentanyl education program. This isn't all encompassing. There's many other agencies that are involved in this legislation and details in the bill, but that's a short snapshot, and I believe Melissa provided the link if you want to take a look at it. But basically, the fentanyl education is to provide education, and there is the website there. It's fentanyledcolorado.org if you want to take a look at it or haven't taken a look at it already. And to help provide information about opiate antagonists in the community, detection tests for fentanyl, harm reduction, and to provide treatment services and information for people in the criminal justice system. Next slide, please. So, like I said, the fentanyl education is part of the legislature's education plan. And this education site offers offenders, jails, probation, Department of Corrections, clients and treatment agencies, trainers, and the general public information about the prevalence and hazards of fentanyl, ways to lower the chances of overdosing on fentanyl, and what ways you can do that. The legal consequences of fentanyl, new treatment options regarding MAT, which aren't so new anymore, but and then post-treatment sober living information and treatment information. I want to talk a little bit about the laws because I don't think a lot of people know about that. But if you're caught with 1 gram or less of fentanyl, it is a misdemeanor. More than 1 gram, it is a felony. 1 to 4 grams, if it is in a different substance, you have to be able to show that you didn't know that it was in that substance. And if you can't, it's a level 1 felony. Otherwise, it is something you can talk to and petition the courts to have it dropped down to a misdemeanor if you can't show that, which honestly, I don't know how you would do that, but that's what the law says. 4 grams to 50 grams, it's a level 2 felony, and 50 more or more grams, it's a level 1 felony. This bill actually is focused on treatment, so getting anybody who has a conviction into treatment services instead of focusing on the criminal part of it is part of what this bill is about. And then if you have a level 4 felony, they can be reduced to a misdemeanor if you complete treatment. And then any misdemeanors or level 4 felony, the participant can request their record be sealed after 2 years probation. Next slide. So our website is called fentanyledcolorado.org, and it launched on January 1st, 2023. It's basically, the terminology is court-ordered learners because that's where we started in this process, but it's for anybody. It's for treatment clients, it's for trainers, facilitators. The general public can access this course and take the class. There's an additional module in the website that trainers, facilitators have to take, which has supporting materials and implementation guides and downloadable materials. So far, we've had over 1,270 registered learners complete the course, which is a good number, I believe. It was a long time coming, but we have jumped up to that number. Next slide, please. Talking fast, I know. So the course has an overview of what is fentanyl, effects of fentanyl has on the body, what the different forms of fentanyl can take, how fentanyl is hidden in other drugs, how strong fentanyl is and how it can kill a person, the new laws and possession, and then they have interviews in the course from people with lived experience. And if you would like to go through a video that shows step-by-step instructions of accessing the web-based course, you can get it at the provider convening website, and I'll drop that in the chat here. On August 17th, 2023, 21 minutes into the video is a step-by-step informational presentation about accessing the course and what each module is about, what each one means, and the steps you have to take to get through the course. And let me send, there you go. Next slide, please. So I just want to give a little history where we were and where we are now. We started out with the jails being our main subject matter, provided trainings, webinars, surveys, technical assistance, information to provide a discharge. And this was a lengthy process because it was the beginning of this project, and that's kind of where we focused on, but we had a lot of
Looks like Karen froze.
the website. So we had a lot of different information and feedback coming out of the jails, which was quite useful. But that took a few months to get that going. So we have some jails who are now using the website and the internet-based course, which is great. One of the things that came out of that surveys and technical systems and trainings and everything was that a video would be very useful for them. So that's kind of how the idea of the video was formed, and I'll talk more about that in a minute. From there, we went on to the probation division of probation services and started working with the heads of that department. They developed a flyer that was given to all the chief POs and pushed that information down to the chief POs to try to get people on board, taking the class, making the referrals to treatment agencies, and getting people who had the convictions the class that's required by statute. And then we also went to the state court administrator's office to work with the chief justices, because we were finding, unfortunately, that the judges were not, it wasn't getting into a court order, which people were getting very stuck on. So working with them to try to get the judges to understand the court order. The Chief Justice quarterly meeting in August. So that will be good. Then we went on to the Department of Corrections SUD programming, and that's been phenomenal. They have jumped on board, and I'll show you my graphs here soon, and implemented this into all their programming for SUD clients. All the facilitators, staff have taken the training and many of their services, which I'll show you the graph here in a second. And now I'm moving on to treatment agencies, providers, which is all of you guys. I I had many meetings with folks, trying to explain the program, see about buy-in, that kind of thing, because this isn't just, as it started out, it was just for court-ordered learners, but we've discovered going through this process that this information in this class, which is an hour long, is not a big lift for folks, and it would be very beneficial to anybody in the field of addictions, especially OUD treatment. And I would say SUD treatment because it's so often mixed with methamphetamine and cocaine. And so the information provided in this class is invaluable to anybody. So that's kind of my push right now. And if you haven't received an invite, next slide, let's go there. So this kind of shows just 2024, the court order learners or fentanyl completions for 2024. And you can see it was a little slow going in January, and then February, March, it bumped up. In April, it took off. And I'm going to do a shout out. I don't know if Cynthia's on this call, but to DOC, because a lot of that came out of Department of Corrections and getting all of their folks trained and seeing this class. So thank you. And then may kind of drop down, but I foresee this going back up the more I reach out to treatment agencies and work with them, and then putting that into their milieu and their classes and their groups. So I find this exciting. I like graphs. Next slide, please. And then completion report for all of 2023 through May of 2024. And you can see that it's up and down and up and down and up and down. And then in May, it was way up. And my belief is, I mean, I can't say this for sure, is that because of my outreach to treatment agencies, that they are having their staff take this class. And the trainers are going way up and way up. And I believe this will continue to go up. There's so many treatment agencies out there in Colorado. And I'm continuing to do outreach. If you have not received an invite from me or email from me regarding the training or the one-on-one I will do with you, please email me at Karen in the chat. And I will send you a meeting request for you and I to discuss the website itself. And the next slide, please. And now we have this video that we have been working on for months and months and months, and it's finally completed. And this will take the place of the web-based course. It has the same information, it meets the statute, and it's very well done. It's about 30 minutes long with times in there to pause, answer questions, and do like a loop and have some feedback from your participants. So we're really excited about this. And we've scheduled 6 different webinars coming up to talk about implementation of the video. And the dates are listed on the slide, but they are June 26th and 27th at noon, July 10th at 10, July 17th at noon, August 7th and August 15th at noon. I sent out a bunch of invites yesterday to everybody's email address that I have. And again, if you would like to be included in this and you did not receive an invite, please just email me and I will send you the links for the webinars. And that's my program very quickly. So I'm going to hand it off to Mark.
Thank you, Karen. I appreciate that. And I also like graphs with pretty colors, particularly the ones that show that things are improving, right? And we're seeing an utilization of the material that's been developed. So I'm really glad to see that. Glad to see treatment programs getting on board as well. So thank you. So I am ready to talk to you about BOSSOs. and the BOSO RFP. And that requires me to start with a disclaimer. I'll do I think everyone here probably has heard what a BOSO is, but nonetheless, I'm going to give some basics of what this is. This is intended to give an update on the process, but I won't be able to take any questions because we are in the midst of an open procurement. So the RFP for the BOSOs is out there. The slides will also kind of make sure people know where they can find that and additional material. Nothing that I'm presenting today has not already been presented during some bidders conferences. So there's no new information here, but there's a lot of people here that maybe haven't been exposed to some of this. So we really want to make sure the provider community is up to speed on the change efforts that we're making related to how BHA will buy behavioral services and invest in the expansion of the behavioral system. So behavioral health administrative service organizations are companies, organizations that will establish and administer regional networks of providers of safety net behavioral services beginning July 1 of 2025. So BHA and Colorado stakeholders co-created the structure, roles, and standards for the BOSOs. See RFP section 8. B8 for more information about that for anyone that wants to go and check out the RFP online. We can go to the next slide. So again, for those that are less familiar, we've been buying services for Coloradans through lots of different approaches. We've historically bought mental health services directly from community mental health centers. We bought substance use services, treatment and recovery support services through our regional managed service organizations, and we've bought statewide behavioral health crisis services through regional administrative service organizations, yes, with different maps. So this is about trying to have a more integrated system where we can buy services in a more effective way with regions that are going to align with Medicaid's regions. So here's the services that the BOSOs will be responsible for. Certainly network development, contracting and maintenance, care coordination and care navigation services, data collection, analysis and reporting, quality monitoring and improvement, community and provider outreach and education, fiscal management and timely payment services, and certainly other services as well. And again, that gives the reference so people can go and look in the RFP themselves and see in much greater detail what's covered there. We can go to the next slide. And again, hopefully this map is not new to people. This is the same map, as I mentioned, that Medicaid's healthcare policy and financing's regional accountability entities will have. So there will be greater system alignment that way. And you've got Region 1, which is, Western Slope and then some as it reaches down into Southern Colorado, the San Luis Valley, and a little further over as well to include Pueblo and Los Alamos. Region 2 is really Eastern Colorado with some Northern Colorado from Baca in the southeast corner up to Larimer County, north on I-25. Region 3 and 4 are really dividing up some of our more metropolitan communities, with also having some mountain communities connected to them as well. So El Paso, Teller Park, Jefferson, Clear Creek, Gilpin, Broomfield, and Boulder are all going to be in Region 3. And then you've got Denver, Adams, Arapahoe, and Douglas. They're all going to be part of Region 4. So move to the next slide, please. And this is the timeline that we're working on. So RFP posts, it's been out there for a little bit now. We accept questions from potential bidders. They're able to post those. And then we have to respond to them, and we did by the June 14th deadline. There'll be a second round of questions. You can see when they're due, and then we will answer those questions by July 3rd, right before hopefully everyone's enjoying a long holiday weekend, except for the poor people that are working on their RFP for the BASOs. So sorry for that. But we're excited you're applying. And that's a key thing to recognize, that no further questions can come in. And again, the reason for that process is that it's fair. Questions are posed directly through the system, and then all the questions that we receive and our answers are publicly posted so that everyone has an equal opportunity to kind of get those clarifying questions answered and to see what those answers are. We can see that the final submissions are due to the email address listed in the RFP by 5 p.m. and that's Mountain Time on July 12th, 2024. And then July and August, we'll be working on scoring with a goal of September of 2024, us being able to release a notice of intent to award. The intended vendors will be contracted, and contract negotiations will begin for a January 1st, 2025 start, but also recognize services that they'll be funding won't begin until July 1 of 2025. So they'll be under contract by January 1 so that they have those 6 months to build their networks and to put things in place so that we can have a smooth transition from how we've historically purchased services, MSOs, ASOs directly from mental health centers, transitioning that to our ASO system. All right.
Mark, we have a question in the chat.
And I'll see if I'm allowed. So just to confirm, there will be one BASO per region. We will select a BASO for each of the 4 regions. It is not prohibited for a company to apply to be a BASO for more than one region. So hopefully that addresses your question. Cool, thanks. That one was legal. That was, I'm allowed to answer that. Thank you, Melissa, for putting the vendor self-services website up there for everybody. And yeah, this is how to apply, information about where to find stuff. Once again, due dates. And there we go. I don't think I've got any more slides to present on that. And so with that, looks like we might be getting done a bit early, but I want to thank you again for attending. I want to remind people of the different ways where you're able to engage with BHA. Certainly the provider convening that we're having, which is the 3rd Thursday every other month. The next one will be August 15th. And then you can also go to the BHA engagement calendar. That link is there. Put into the, we can make sure that that's, thank you, Melissa, way ahead of me, already has it right in the chat as well. So thank you very much. And with the last one, just reminding, please stay connected with the BHA. Lots of different ways. We're on all your favorite social media networks. So stay connected, and thank you for your participation today.